Hi, I'm TT, and this is... Whoa, hey, that's Spider-Man. What is he doing here? Okay, let's try this again. Hi, I'm TT, a 5-year-old boy diagnosed with Juvenile Idiopathic Arthritis, aka JIA, last year. This is my twin brother DT. Although we are twins, I'm the only one who has the diagnosis of JIA. Oh, this is my mom. Can I tell you a secret? I'm going to be a big brother. We are both excited to start school in the fall. But before we can start school, we need our vaccinations. Let's talk about immunizations now.
The state of Minnesota's immunization law requires children enrolled in school to be immunized to be protected unless they have medically or non-medically exemption. 5 required immunization and vaccine for children ages 4 to 6, Hep B, polio, MMR, varicella, and DTaP. The CDC's 2025 immunization recommendation for COVID-19 vaccine is at least 1 dose of the current vaccine, and for the influenza are yearly. However, in some children, they recommend 2 doses. Now let's take a look at DT immunization records and his overall health status. DT is up to date with all of his immunizations, including the COVID-19 vaccine and flu vaccine. He's physically active and loves outdoor activities. Let's take a look at TT now. TT does have all immunization up to date from birth to 2 years of age, but does not have the updated immunization for this year from that point on, including the COVID-19 vaccine. TT was diagnosed with JIA last year at the age of 4. He was clinically presenting systemic onset of JIA, such as swelling of joints, intermittent fever with rash and limp movement in early morning. He was prescribed and treated on a DMARDs regimen. Now let's watch a short clip about disease-modifying antirheumatic drugs, aka DMARDs.
I'm Dr. Kinneret, TT's rheumatologist. I see, you just finished learning about the different types of DMARDs medication. Per report, it appears that TT's symptoms are getting worse. Let's get him started on a different medication. We have a 5-year-old male, diagnosis of systemic juvenile arthritis, treated previously with methotrexate.
Was it a combination with NSAIDs and corticosteroids?
Yes, he was. Let's keep him on the prednisone longer and switch CMARDs to BMARDs.
No, per the 2021 American College of Rheumatology, SGIA should be the biologic combination of IL-1 and IL-6.
TT is prescribed with anakinra, aka Kinneret.
This is a biological DMARDS therapy.
Let's go ahead and enroll him in the Kinneret clinical study through the Pharma Child
Yeah,
Registry.
that's a great plan. I'll update you how he does in the clinical trial.
Thank you.
There was a study that anakinra have high efficacy.
69.7% reached a complete remission. 63.6% on clinical remission with medication.
You know, there may
And
be some refractory
6.1%
periods.
remission off medication. That may be a small margin. but a win-win.
Interesting.
Here's an update on the anakinra study that TT is enrolled in. TT's now 18 months in the clinical trial and has been doing great. He only had the one-time episode of the macrophage activation syndrome. Okay, let's wrap it up.
TT is not quite at the clinical remission off medication, but is being well controlled in with anakinra, a IL-1 inhibitor. However, TT is classified as in clinical remission on medication. The anakinra therapy was effective, and TT is now 6 years old and getting ready to go to school again.
TT is now 6 years old and starting 1st grade. He needs to get his vaccinations for 1st grade. TT's mother is needing more support now that she have a 3rd child, a baby girl. However, she needs to consult the doctor about TT if he should get vaccinations, because last year TT did not receive any due to his condition.
Hi, Dr. Kinneret. What is your recommendation for TT now that he is doing better with biological DMARDs?
Great question. TT is doing awesome. I also wanted to let you know that it's your choice if you choose to vaccinate him or not. Studies have shown that vaccinating children 6 and under does not cause any flare-ups in their arthritis. Only avoid live vaccines, which are MMR, rotavirus, chickenpox, and etc. I hope this can give you some peace of mind.
Thank you so much, Dr. Kinneret. This helps a lot. I will make a decision and vaccinate TT.